A very good evening. Amid the H3N2 scare, the nation today saw a single-day rise of over 1,000 COVID-19 cases after 4 long months. India has recorded 1,071 fresh COVID-19 cases in the last 24 hours alone. The active cases have increased to 5,915 according to the Union Health Ministry data. A total of 76 samples of COVID-19's XBB variant have been found, which might be behind the recent rise of cases in the country, according to the Genomics Consortium data. Now, the variant has been found across Karnataka, Maharashtra, Puducherry, Delhi, Telangana, Gujarat, Himachal Pradesh and Odisha. The government has issued a COVID advisory in all 6 states. These states are Kerala, Karnataka, Tamil Nadu, Telangana, Maharashtra and Gujarat. The centre has also asked to follow a test, track, treat and vaccinate strategy and closely monitor the emerging clusters. Various states including Delhi, UP, Karnataka, Maharashtra have all issued advisories, and these include avoiding crowded places, maintaining social distancing, following cleanliness and hand hygiene, of course. Children and the elderly have also been asked to follow special precautions. Notably, remember, India is also witnessing a surge in H3N2 influenza virus cases as well. And as per the Health Ministry data, the number of cases has reached 451. This was till the 5th of March. The Health Ministry has also issued influenza prevention and control do's and don'ts, but the rise in cases have raised concerns among citizens as well as health officials. We've opened our call-in lines as well because we have a team of experts joining us this evening who will take your calls, who will take into account everything that you have doubts about, because remember, this is a double trouble that continues to stare at all of us. Dr. Sanjeev Bagai, Chairperson Nephron, with us, along with Dr. Sandeep Nayar, Senior Director and Head Respiratory Department, BLK Max Super Speciality Hospital. We also have Dr. Sudhir Bhandari, Member of Government Advisory Committee on COVID and Principal and Controller, SMS Medical Hospital, an attached group of hospitals, Jaipur. Thank you, doctors, for taking out your time. Really, because this is something that is very, very concerning and affects each one of us. But I want to begin by asking Dr. Sanjeev Bagai, amidst the H3N2 influenza and the worry that continues to loom, Dr. Bagai, we suddenly see this surge in COVID cases as well, crossing the 1,000 case mark in just the last 24 hours. So how concerning is this, and what immediately should be on our minds to make sure that we're well prepared and we're well ahead of us?
Good evening everyone. So just in bullet points, I think the most important thing is clinically is to differentiate when a patient comes in with upper respiratory symptoms or fever, very much like a viral, as to along the lines, are the symptoms along the lines of COVID or seasonal allergies or a common cold, which could even be adenovirus, so on, and indeed H3N2. So I think the clinical decision making is important, not to jump into rampant tests on day 1, day 2. Play a wait and watch, but isolation policy, wearing a mask is extremely important. Testing at an appropriate time is important. I think screening for influenza is important. Vaccination for influenza is readily available for the past decade or so. It gives almost a 50 to 75% efficacy, and it's useful. But the more important point what I want to drive home is COVID is not over till it's really over. And I think we don't need to put our guard down. Masks have become history. COVID itself is fading in people's mind. So I think programs like this is going to drive home the point that avoid crowded places. If at all you're going out and there is crowd around, please wear a mask, a suitable N95 mask. If you have any fever, upper respiratory symptoms, sore throat, or a mild cough, irritation in the throat, please isolate yourself. Do not expose yourself to others. Remember, Omicron is not as mild as we initially thought. We are seeing XBB 1.5, and now the new kid on the block is XBB 1.16. This has 1.2 times more infectivity than the original Omicron strain. I also must add that Omicron has mutated so fast that we've seen more than 1,000 sublineages, 1,000 sublineages. So I think we need to be on guard. The message is not to panic. It's a simple wait and watch approach, but be sensible, inform your doctor, don't self-medicate, do not take antibiotics at home, avoid drugs like aspirin, brufen, nimesulide, which can harm your blood vessels and indeed your platelet count.
Okay, always go by the doctor's advice, something that all of us have learnt nice and proper through our fight against COVID. But Dr. Sandeep Nayar, tell us more about the XBB 1.16. Dr. Sanjeev Bagai just called it the new kid on the block, but how concerning is it? Are we to make of it in terms of what we've seen previously as well with regards to certain other variants wherein the hospitality rate is largely going to be low? Is it as infectious? How can you tell us about, what can you tell us about the features that this usually carries, sir?
See, the virus has always a tendency to basically mutate. This is how the virus behaves. Let it be anyone. Let it be influenza, let it be COVID. And COVID, we have seen number of mutations going on, and we have got different variants, right? From if you remember, there was a havoc which was created by one of the variants. Then we came Omicron, of course, from Delta, and then now we are having the XBB. Now, this is just a different variant, which is a behavior of a virus. Now, first of all, let me, through you, tell everyone, there's nothing to panic as such because of many reasons. One, we are now prepared for many infections because last 2 years back, we didn't even know what this enemy is. This COVID which came like a new thing, and we had knew nothing about it, and every new medicines were tried on. Now at least we know it. We have many beds available, we have oxygen available, we have many medications available, and we are much more experienced now. So nothing to panic as such. And of course, there is a double whammy at present. There is an XBB, COVID, and at the same time we have H3N2. And many a times the symptoms are, difficult to distinguish also. The patient might come to you with upper respiratory tract infection. They might come with a cold, fever, headache, but they can be due to many. Now this XBB variant is, of course, very infectious. It spreads like anything. But at the same time, fortunately, it is not as dangerous as the Delta virus was. The only thing I would like to request you, which I will reiterate what my predecessor has said, let's take precautions. That COVID appropriate behavior is not going anywhere. Please follow them. That social distancing, hand hygiene, wearing a mask, and of course, if anyone who has not been vaccinated fully, please vaccinate yourself, because that is the only way we can protect as of now, because there is no definite bullet for COVID-19 as such. But nothing to panic. More of conservative treatment. Avoid unnecessarily antibiotic, which everyone is taking it, but more of supportive care is the need of the hour.
Okay. So, Dr. Sudhir Bhandari, two quick questions. One is, of course, with regards to the transmissibility, which we've all been discussing already. But, since both the doctors previously also pointed out the other challenge that lies ahead of us and how it's coinciding with this latest COVID surge. Now, how does one really distinguish whether or not this is the influenza, whether or not this is a COVID symptom? Because most of the viewers, most of the people we've been speaking with, interacting with on a daily basis are not quite able to figure out, because then you have your common flu as well, given the weather change and the latest, cough problems that many around us are facing day in and out. How does one distinguish? When does one know that, okay, look, I have to definitely go for a test, and look, this is the protocol that I must follow for I'm sure what's happening?
Now, make sure whether it is a COVID or non-COVID, that is influenza, that is H3N2, to begin with, all have the common respiratory symptoms. These respiratory symptoms are high-grade fever, the cough, cold, congestion, etc. But always remember, those who have been already vaccinated and those who have taken the booster dose of COVID, they probably stand protected for the COVID symptoms. And normally, they have the upper respiratory tract infection, fever coupled up with the headache and nasal congestion, and the breathlessness is not an important component, and the fall in oxygen saturation is not an important component in any flu or the H3N2. So if you are vaccinated, if you have the simple viral symptoms with no breathlessness and no falling oxygen saturation, I think they can think preferably that they have the influenza or could be H3N2. While in the COVID infection, there is a lot of increase in infectivity with the newer strain, as it has been told, and there will be probably a history of travel, There'll be history of going to congested place. One thing I must clarify, whether it is a COVID or non-COVID influenza, it always is spread through the droplet infection. Hence, the prevention is better than cure, and following the COVID appropriate behavior, which is valid for H3N2 or the influenza also, the preventing the congested places, the using the mask, frequently hand washing, because whether it is a COVID virus or the influenza virus H3N2, it remains viable on the surface for few hours. If you touch your hand there, if you are not sanitized your hand, if you touch your nose and mouth, probably you can carry the infection forward. So definitely the simple influenza will have classical these symptoms, but breathlessness and falling saturation is little uncommon except in children under age of 15 or elderly people who are immunocompromised. But the true is that anyone has these symptoms and he is unwell, probably consult a doctor so that they can take the call of getting the influenza investigation or the COVID test done. One thing I must clarify, that for both the situations there is a vaccination available. Those who have received the COVID vaccine but they have not received the influenza vaccine, it is prudent to take the annual influenza vaccine, which covers H3N2 also, which is a subtype of influenza A, and especially those who are diabetics, elderly, cardiac patient has to have the influenza shot coupled up with if they have not taken the booster shot for COVID. So a deteriorating breathing problem, falling saturation, probably that goes more in favor of COVID with a history of travel and coming
So perhaps the way in which H3N2 influenza spreads is also in a way very strikingly similar to how COVID spreads, how it reaches from one person to another, and in that sense the precautions may also, like all three of you have been pointing out, are very, very similar to that effect. Wear your masks, keep your hands clean, sanitize your hands on a regular basis, maintain social distancing, basic COVID protocols that pretty much have become a way of our life is something that we must follow given the kind of challenges that continue to stare at us. Doctors, thank you so much for that insightful conversation. I'm sure it's really helped our viewers, because remember, we've seen a sudden surge of 1,000+ cases the last 24 hours, so bound to give birth to certain questions to that effect. Thank you for speaking to us and taking out your time here on Times Now.